Hello guys, welcome back to my YouTube channel Medical Peace. So in this video we are going to discussing about something which is very important topic, that is neoplasia. In this, neoplasia acts as a major role in general pathology as well as systemic pathology. So guys, if you are reading CNS, there will be a CNS tumors. So if you are reading lung, there will be a bronchogenic carcinoma. So if you are reading liver, there will be a hepatocellular carcinoma. So in this, neoplasia acts as a very major role. So at the end of this video, I will be providing notes related to neoplasia. So let's discuss about neoplasia. In neoplasia video, we are going to discussing about difference between benign and malignant cells and morphology of neoplastic cells, at the end paraneoplastic syndrome, which is a very important topic in neoplasia. So let's discuss what is neoplasia, guys. See, for this term we have to segregate into two parts, neo and plasia. Neo is nothing but new, plasia is nothing but growth. Neoplasia is also called as new growth. So can any new growth can we consider it as a neoplasia? For example, embryogenesis. See, in embryogenesis we know new organs and structures will develop. Can we say this as neoplasia? New organ or structures. Can we say this as neoplasia? No guys, we can't say this as neoplasia. For example, take this as a normal cell. Normal cell, in normal cells, proliferation and maturation are highly controlled, but this as neoplastic cells. In neoplastic cells, proliferation and maturations are lost, so they are free to divide. In neoplastic cells, there will be a atypical mitosis, but in normal cells, there will be a typical mitosis. So, we will see the proper definition of neoplasm. A mass of tissue formed as a result of which is abnormal, excessive, uncoordinated, autonomous and purposeless proliferation of cells even after removal of growth stimulus which caused it. So in neoplasm there are two types, one is benign and the other one is malignant. So before moving on to these differences, we will see the morphology of neoplastic cells. See, for morphology of neoplastic cells, you people have to remember one term, that is nothing but differentiation. For example, take this as parent cell which is giving rise to this progeny cells. See, if these parent and progeny cells, if appearing similar, there will be a good differentiation. If it appears different, that is bad differentiation. If it is a lack of differentiation, that is nothing but anaplasia. Anaplasia is nothing but lack of differentiation. Next, remember loss of polarity. See, take this as a basement membrane. These are the cells. In this nucleus is there. So this is a normal cells. See, observe this nucleus which is towards the basement membrane, that is normal cells. See, take this as example. Here nucleus is away from the basement membrane. So this is neoplastic cells. So here we can see here loss of polarity in neoplastic cells. Then third one is pleomorphism. Pleomorphism is nothing but change in shape and size of the cells. Here it is almost equal, like nucleus is towards the basement membrane and here nucleus is away from the basement membrane. So there will be a change in shape and size, nothing but pleomorphism in neoplastic cells. And the third one is increase in the nucleocytoplasmic ratio. Here in normal cell it is 1:4 to 1:6 ratio. In neoplastic cell it is 1:1. And the third one is hyperchromatism. which is almost present in neoplastic cells, and the last one is mitotic figure, which is atypical in neoplastic cells but it is normal in benign cells. So let's discuss this difference between benign and malignant tumor. In that, first feature is boundaries. See, in benign cells it is encapsulated. Encapsulated is nothing but, see here, it is protected from the capsule. So we can say this as local invasion is absent. Invasion tendency is absent. In malignant cells it is non-encapsulated. Local invasion is present. It is spreading type of cells. So the second feature is size. In benign cells it is very small, but in malignant it is a large cells. And the secondary changes are, in benign it is less often, but in malignant it is more often. So these are the morphological features. But coming to the microscopic features, in basal polarity, as I have said before, in benign cells basal polarity is retained, but in malignant cells it is lost. Pleomorphism, nothing but change in the size and shape. In benign it is not present because it is a normal cells, but in malignant it is present. And coming to nucleocytoplasmic ratio, in benign it is normal, but in malignant it is increased ratio. Coming to hyperchromatism, in benign it is absent, but in malignant it is present. In coming to mitosis, it is typical mitosis, like mitosis is nothing but division, but in malignant cells mitotic figure will be increased, that is atypical mitosis we can see. Metastasis, in benign metastasis is absent, malignant it is present. Metastasis is nothing but spreading type of cells, mainly we can see in malignant cells. Anaplasia, as I have said earlier, anaplasia is lack of differentiation. In benign it is absent. In malignant it is present because in benign it is having a good differentiation, but in malignant there will be a lack of differentiation. In growth rate, benign it is usually slow, but in malignant we can see rapid growing cells. Let's discuss about paraneoplastic syndrome. First we will learn the definition of paraneoplastic syndrome, then I will describe briefly about that what a paraneoplastic syndrome actually means. At the end of this video, we will see the major and minor examples of paraneoplastic syndrome that are most likely to be asked in exam. So let's move towards the definition. Definition is distant systematic effects that are unrelated to metastasis. In order to understand the definition, let's move to the explanation part. Here, tumor of an organ metastasizes into the bone. Then it is entering into the bone, they cause breakdown of the bone which releases calcium in the blood cavity. So causes hypercalcemia. Now the tumor caused hypercalcemia. So guys, can we consider it as a paraneoplastic syndrome? The answer is no. This is directly related to metastasis. So we cannot call this as paraneoplastic syndrome. Paraneoplastic syndrome, it should be unrelated to metastasis. So let's move to the similar example. Here, tumor of an organ metastasizes into the bone which is releasing a chemical called parathyroid hormone related proteins. This hormone and acts as a bone releasing calcium into the blood, that will cause us hypercalcemia. So we can call it as a paraneoplastic syndrome. Now, in mechanism, the first one is ectopic secretion of hormone. As I have explained now, for example, if there is a tumor that secretes ACTH or PTH, that is parathyroid hormone, it causes distant systematic effects related to that hormone, that is nothing but paraneoplastic syndrome. The second one is cross-reacting antibodies. Now you know all tumors are subjected to many mutations. Now sometimes these mutations alter the antigens to a slight extent, forming a new antigens and fighting against the new antigens. Immune system getting activated against these antigens. So these are the two mechanisms, and the last one is release of chemicals. So next move on to the major examples. In major examples, I have categorized into 4 types. One is endocrinopathies, vascular and neuromuscular, cutaneous examples. In endocrinopathies, again I have categorized into 3 parts: Cushing syndrome, SIADH, hypercalcemia. In Cushing syndrome, due to the release of ACTH, which will causes small cell carcinoma and pancreatic carcinoma. And the second one is SIADH, nothing but so the second example of endocrine related SIADH, nothing but syndrome of inappropriate ADH, which is caused by the release of antidiuretic hormone. It includes small cell carcinoma. Then hypercalcemia. It is due to the release of parathyroid hormone related proteins. In that it will causes squamous cell carcinoma of the lung and breast carcinoma. And then in vascular category, it is having a Trousseau syndrome. It will causes due to the release of procoagulants. It includes pancreatic cancer and bronchogenic carcinoma. So the next category is neuromuscular. It will causes myasthenia gravis. It causes due to the release of antibody against acetylcholine receptors. So in this it includes thymoma and bronchogenic carcinoma of the lung. Then cutaneous. In cutaneous category, it will causes acanthosis nigricans. It is a immune mediated which causes gastric carcinoma. So this is all about paraneoplastic syndrome. So in my upcoming videos, I will come up with few more informative videos. So up to that, don't forget to like, share and subscribe to my channel, and thank you for watching my channel. Stay tuned guys.